Thank you for coming to Health and Human Service. We apologize for being a little late. Things just didn't go just exactly right today. But anyway, we will start this one. So, Madam Clerk, will you call the roll, please?
Commissioner Baker McCormick.
Here.
Commissioner Marecki. Commissioner Anderson. Commissioner Killeen.
Here.
Chair Scott.
Present.
You have a quorum present.
Thank you. Anderson had said that he would not be able to stay. I think he's going. Okay. Next item, please.
B, Chairwoman's remarks.
None. I guess I said mine earlier. Sorry about that. Okay, next item, please.
C, approval of the July 21st, 2026 meeting minutes.
So moved by Commissioner McCormick, supported by Commissioner Marecki. Thank you.
Please vote using your tablets.
Oh, it's on the cabinet. That's right.
Commissioner Marecki. Are you a yes vote? Thank you. Motion carried.
Okay. Okay. All right. Thank you. Motion approved. Next item, please.
D, unfinished business. There is none listed.
Okay, next item, please.
E, new business. Items 1 through 5 are reports from the Department of Health, Human and Veteran Services. Item 1, reporting a status report on the activities of the Just Air Initiative. Item 2, status report on activities of the Empowerment Plan, Coats for Hope Program Initiative. Item 3, a status report on activities of the RIP Medical Debt Initiative. Item 4, a status report on activities of the naloxone vending machine initiative. And item 5, a status report on the activities of the Vision to Learn initiative. And item 6, my apologies, reporting a status report on the activities of the Eastern Market Fresh Trucks Program Initiative.
Okay. This is a receive and file all items. Does anyone have any questions on these receive and file? Okay, Commissioner Killeen.
Yeah, and I've raised this before on the air quality stuff. We have them all out there. I'm anxious to turn this into action of some sort. So I see in your report a few things, but how is this helping to drive policy?
Thank you for the question. Dr. Ajaris Martin, Chief Programs Officer for Wayne County Health, Human and Veteran Services. That is something that we are continually working on. I think in the county so far, what we've done is we started a kind of an informal air quality working group with our partners at EDD, as well as our partners at DPS to align on all of our efforts. So from environmental health, on the side of HHS, as well as our Just Air initiative through what we're talking about here, DPS through the complaints that they receive from the landfills, and then EDD around resiliency hubs, knowing that, you know, the instances of air quality exposure and incidences like we've seen with the Canadian wildfires will increase. So all of us are internally aligning to see what can we do, what's within our rights, what's within our powers, knowing that, again, air rights are not that enforcement doesn't sit with the county. It technically sits with the federal government. And then Eagle, of course, is our, you know, the state designee for who can control that. So we are developing a policy agenda with closely and tied with the chief, with county executive. And then the next iteration of this contract is fully focused on action.
Are there going to be more monitors in the next contract?
No, there will not be any new monitors, but however, there will be monitor replacement is what we're kind of calling them. So of course, now we have around 2 years, a little over 2 years of data. So we've been able to see trends. So we're proposing kind of reallocating where monitors are positioned, knowing that hotspots and having redundant monitors in some areas to pick up a better kind of range of what's going on in the area.
Are there enough monitors out there that we could produce our own report to the citizens of Wayne County?
Yeah, so that is
to say over the last month or over the last quarter, this is what we see in air quality around Wayne County?
So that is something that we're working on too. So we know that Just Air has their public facing dashboard, but it's kind of like real time data, no historical data.
Yeah.
However, our epidemiology team, under the direction of Dr. Katerina Stelliano, they are developing in the final touches of an external dashboard that we hope to review internally for quality checks and then push it out externally.
Yeah, because I want to see those numbers.
And it'll have all the trend data, yeah. And so
Right.
we're trying to make sure that it makes sense to the everyday citizen, that it, it doesn't take a lot to understand it. So that team has been working on that for over a year. So we're excited to launch that.
Yeah, I think that to turn it into useful data for the citizens to kind of understand. And then on the Narcan, how frequently are those used? How many?
Each and every day. I think we we receive a lot of feedback, and we have Dr. Avani Chef, who's our chief medical officer here, if you all have more questions. But every day.
Well, I'm just wondering, like, how many have gone out through this?
How many number of locations or number
No,
of?
we have 97 stations, but
Yes.
how much are citizens using those?
Yeah, so
Because we must know how many.
yeah, absolutely. So per the report, we've had over 40,000 naloxone kits dispensed. So that was as of kind of mid-July. We've had over around 14,000 fentanyl testing strips dispensed, and then around 9,000 xylazine testing strips dispensed.
Yeah, because I love all of the programs that we're looking at today.
No, thank you for
But
that.
I just want to make sure
Yeah, no,
it's useful.
yes, and so we have a quality data assurance kind of check through the Well Wayne stations as well. What we don't try to do is change up too fast, because it's one to place it, then we have to market it, and then we kind of monitor usability. And so all of our agreements, our MOUs, our informal MOUs with all of the sites, we are able to relocate the station if it has low user rates. So
And
that
we have
is a
done
part.
that.
Yeah, so that is
Okay.
what the team is currently, that's kind of, now we're in that phase officially. So first was implementing, then it was marketing. Now we're in, okay, is this generally where it should be to have the highest access for the community?
Thank you. Thank you, Madam Chair.
Very good. Thank you, Commissioner Marecki.
Thank you. Are you able to track like how many 911 calls come in after somebody goes and gets whatever? The strips, no, but
yeah, so that was a project that we tried to start when I first started here. And dissimilar from a lot of other kind of counties and geographies in the state of Michigan, our ambulance services are privatized. And so the dispatch services are also privatized. So it's very hard to have like one streamlined source of data just across, I think, our county. There's over 9 emergency dispatch services. So we do not have a way quite yet to figure out how to monitor all of them at the same time. However, that's something that we've been thinking about.
yeah, just to see what, would all the 911 calls go to the same centers, or the centers?
No, all the centers, yep. So they're
Okay.
all privatized and kind of their own
The centers
entities
are.
within the state.
Because I didn't know if there was one and they were dispersing the ambulances.
No.
Okay,
Okay,
thank you.
thank you. Now, where they're distributed to, do they call you if they need more?
They don't have to call us. So
Oh.
we luckily have a partnership through this program through Wayne State,
Okay.
where they go out and do the checks and refill stations. So it is they can, so they know how to contact us. And there's also kind of magnets on the side of the station if it needs to be refilled. But we haven't had an instance where someone has complained that it wasn't stocked, because we have people checking them regularly, almost weekly.
Okay, all right. Because where I do my coffee hours, we have the training there too. Yeah,
Yeah,
Yeah.
so important.
yeah. Thank you. Thank you for coming.
Yeah, of course.
All right. Okay. Since there's no more, we have a motion and support.
No, I was
No.
just pointing
Okay.
that we had
All
a
right.
motion.
Okay.
Mhm.
Yeah, we did. This was for all 6.
Yeah.
Yeah.
And I know yes.
Okay.
Oh, yeah,
Thank you. Motion carried.
you're out there in the wasteland.
Next item, please.
Moving to item 7, requesting commission approval of an emerging threats local health department grant agreement with the Michigan Department of Health and Human Services to support the emergent cyclosporiasis outbreak response.
Okay. So,
Hi, good afternoon. Dr. Avni Sheth, Chief Medical Health Officer for Wayne County HHBS. This is for your approval, $35,000 emerging response grant funds that the state released to help offset some of the additional costs that local health departments have had to incur to respond to the cyclospora outbreak that I know that you are all familiar with. This is to support some of the additional, we're utilizing it for primarily for the additional staffing costs and overtime costs for our teams to do the case investigations that are pretty lengthy for this outbreak. So we are fully utilizing these funds for that purpose.
all right. Thank you. Any questions on that? Commissioner Colleen and then Commissioner Marecki?
So it's the local health department that has to do the investigations.
Yes, for all the cases that are in our jurisdiction, we're doing the initial kind of case investigation. So collecting really all the information of their symptoms, but also then the food history for, kind of the 2 weeks prior to symptom onset. And then we're putting that in the surveillance system, which then gets analyzed by the state and federal authorities to kind of trace back and triangulate and analyze.
So we kind of interview people.
Mm-hmm.
What have you been eating?
Mm-hmm.
That kind of stuff.
Exactly. And it's pretty detailed, you can imagine.
Yeah.
And we even, if they opt into that, get their, shopper's card number to then collect everything that they purchased at the grocery store as well in the 2 weeks prior. So a lot of extensive data collected on, focused on fresh produce.
All right. One more question. Oh, what is the trajectory in the county as far as cases?
Yeah.
On the upswing?
So thankfully, it looks like cases are slowing down. We're still getting new cases every day, but these are primarily because of the lab delays, labs that were collected probably 1 or 2 weeks prior, and then also because of how cyclospora develops typically after 1 to 2 weeks after being exposed, that these are likely cases that were exposed probably around mid-July latest, right? And so we are getting new cases, but it's not, newly transmitted cases, I should say. And so we do feel like with our cases kind of slowing down, and then also another thing we're closely looking at is the percent of emergency room and urgent care visits for diarrheal illness. And that also has been on decline. And almost close to what they usually are around this time for background, just people getting sick. And so those 2 things are promising that we are on the decline for this, and we've kind of hit the peak. And the bulk of the contaminated produce is either recalled off the shelves or past their kind of edible date time. So we're hopeful that we're kind of at the end of this.
Yeah, and I was going to ask you that too. So one is the food system is clearing out a bit.
Mm-hmm.
Do we have any evidence of our citizens having changed their behavior, their eating habits as a result of this, and that also contributes to the decline?
Yeah, so I think that, obviously there were lots of messages that we tried to send out to, as the investigation is ongoing and new information is gleaned, we try to share what are the recommendations during this time. And in that was, just really hold off on the bagged shredded lettuce, pre-packaged lettuce as much as possible as the main kind of signal we were seeing in the data. And, everyone has a different level of risk tolerance. And so there are people that are, stayed away from everything for a while. There's people who are like, oh,
Right.
If I get sick, I get sick, so there's a whole spectrum. We know that the data at a national level has shown like people are holding back a little bit in purchasing salads. And we saw, the the percent of folks going to Taco Bell decreased, the percent of people going to other places decreased. So, I mean, there's behavioral change, but we do think this is a true kind of decline in cases as well. Yeah.
And those bagged lettuces and mixed green, and those have been bad news for a long time.
Yeah.
It's been a vehicle for other things that have gotten into our food chain.
Yeah, so we are, we want to continue encouraging fresh produce and greens.
Right.
It's healthy at the same time, and I know those things are very convenient for people. So we are really just promoting like baseline, like food safety recommendations, washing the produce, even if it's like triple washed, wash it, wash your hands, prepare them safely, cut produce safely, cook when possible. Those are all still important messages. And, these things just happen off and on. And so it's really important that we have our strong public health system to respond to that.
Yeah. Okay.
Yes. So the state of Michigan, pulled back their recommendation to kind of stay away from the bagged lettuce and return to kind of routine prevention practices.
Just wash.
So that's a good wash. Yes. And and then just obviously if anything happens, we try to respond very quickly. So we limit how many people get sick.
Very good.
I'll move this item for approval, Madam Chair.
Okay. Been moved and supported. And we voted yes, and a yes.
Motion carried.
Thank you. Next item, please.
Item 8, requesting commission approval of Amendment 1 to a purchase order with 1 2-year option to renew with Sun Valley Foods Company to continue the procurement and delivery of liquid nutrition products.
Okay.
Good afternoon, William Chuck Jackson, Director of Senior Services. This is, as you all know, the department provides nutrition services. There are 4 types of services: congregate meals, home delivered meals, and halal program. And then the 4th is the liquid supplement program, which is a program designed to provide nutritional supplements for individuals who have a medical reason that they either can't consume as much solid food or any solid foods. And so that's what this contract is. It is to renew the supplier or continue the contract with the supplier, Sun Valley Foods, for the next 2 years to provide supplements to those who are needing it in Western Wayne and Downriver communities.
Very good. Did you hear of any of your seniors being sick?
No, we
No.
did not. We
Yeah.
did not. At least it did not get to my attention that
Okay.
any were.
All right. Great. Commissioner Marecki?
Thank you. These supplements, do they have to be by mouth, or do people order these for tube feedings too?
For us, it's by mouth. It's a bottle, a liquid bottle.
But they can't do any tube feeding liquid bottle through the tube, or they're not supposed to.
They're not that we're aware of, right?
Right.
We provide them for oral consumption. Yes.
Thank you.
All right.
I'll move for approval, Madam Chair.
Okay, it's been moved and supported by Commissioner Marecki, and we're all in favor. Motion carries.
Thank you.
Next item, thank you.
Moving to the addenda, item 9, requesting commission approval of a 1-year grant agreement with the U.S. Department of Health and Human Services, Health Resources and Services Administration to support continued operations at the Wayne County Healthy Communities.
All right, these are the 2.
Hi, good afternoon, Dr. Sheth, Chief Medical Health Officer, Wayne County HHBS. This is a approval for the acceptance of the recurring grant we have with the U.S. Department of Health and Human Services, HRSA administration, that provides grant funds, and this is our operational grant that supports our federally qualified health centers, Wayne County Healthy Communities, located in Hamtramck and Wayne. The grant award is for $2.7 million, and this will continue to support the operations of those 2 health centers. We also have online our CEO of our FQHC, Javar Jackson, as well, joining us on Zoom.
Okay. Go ahead, please.
Good afternoon, Javar Jackson, Wayne County Healthy Community CEO. To Dr. Sheff's point, this is a continuation grant for the work we've been doing to address access needs for Wayne County residents in the Hamtramck and Wayne communities. And as most recently, as we discussed at the previous commission meeting, also bringing a third location into our scope of project, which will be in Garden City, which I'm excited to share is actually operational as of June of shortly after the last commission meeting.
Oh, so this will be for all three then?
Yes.
Oh, okay.
Yes.
All right. Thank you, Commissioner Marecki.
It's the Garden City clinic located.
It is located inside of the medical office building of Garden City Hospital.
Oh, okay. All right. Thank you.
Okay. All right. Thank you, Commissioner Colleen.
Thank you, Madam Chair. Is that Garden City Hospital still open? Yeah.
Yes, it is.
Because I knew there was talk, seems like 3 or 4 years ago that they may not. So what is the trajectory of the number of people that we're seeing at our clinics? Is it flatlined? Is it growing? What's going on there?
It actually has increased from year over year. So this year we've seen 2025, we saw just under 10,000 visits between two of our locations, the ones in Hamtramck and in Wayne. With the addition of the third site, the Garden City location is really used as a alternative method instead of using emergency room as a primary care facility. We recognized in the Garden City community immediate area that just over a portion of those folks did not have a primary care home. And so our focus here is that we're assuming, our assumptions suggest that we'll see around 300 unique patients in Garden City in this coming year.
Okay. And number of people lost their Medicaid in Michigan. And a lot more to come in December, January, when the big whatever bill really kicks in and people lose their subsidies. Are you planning for, what's your patient mix right now? People that have no insurance versus Medicaid versus having, a full Blue Cross Blue Shield?
Majority of our patients are Medicaid eligible, but to your point, that can change month over month in terms of redetermination. Right now, 60% of our patients are Medicaid eligible or underinsured combination. And so we have our internal efforts to provide education to those patients when we notice that their determination time is coming up. We have marketplace specialists on our staff that can help with the navigating the benefit conversations, as well as getting selections to ensure that they don't lose coverage. But it is an ongoing, it's an unknown, right? Because we don't know fully what December will call for, but we're trying to be as proactive as possible with what we do know.
Yeah, but we do know we're going to lose some. And so as you look at your fiscal planning going out, how much room you got to lose? I'll just give a number like 15% of your Medicaid people no longer have an insurance. How much of that can you absorb?
Yeah, really good question. So, the grant that we received from HRSA is a supplement to our work that we do to support healthcare outcomes. Unfortunately, FQHCs don't run with margins that are very strong because of our patients who are in need of care. And so with the Garden City location, one of the strategies that we are working on is diversifying our presence in terms of payer mix. And Garden City, Westland community has a heavy presence of Medicare and Medicare eligible patients. And so as we're trying to diversify, our payer mix, in short, it's hard to say that if we lose 1 to 5%, it can be we will fill it because of those margins. But this is where advocacy comes in from the state and federal level. That's where we try to advocate with HRSA to understand some of those challenges that will exist with that ever-changing landscape. But regardless, if we lose 1% to 30%, it will be felt. But FQHCs have been around for 60 plus years, and they've learned how to toughen up, through those processes. And so I don't have any hesitation to believe that we will shutter our doors. On the contrary, I believe that we learn from the experiences that we've had over the times, and continue to learn where we are now to try to create that access point still for our patients in our communities.
Well, I very much appreciate the kind of bind you're in there. And if I can just comment, Congress did this, what do you say, 60 years ago for FQHCs and FQHCs look-alike. And the reason they did that 60 years ago is because of the difficult environment for poor folks to get proper health care. And so Congress stepped in and said, okay, we got to have these FQHCs. So now being squeezed even more. But you were already in a tough environment 60 years ago when Congress first approved this. So nothing but the best to you, sir. Thank you. Thank you, Madam Chair.
So the other two, have the amount increased of folks coming in? Like the Hamtramck and the one, the two originals.
Yeah, so from 24 to 25, we saw close to a 35% increase in patient visits. And that's primarily due to our efforts to streamline our operations and to build visibility in the communities. That doesn't mean that our work is done. We still have more work to do. It's an age-old challenge to Commissioner Colleen's point that even though we've been around 60 plus years as a collective, you can talk to your neighbor and they won't know that FQHC exists. And so we still are challenged to create that operational narrative and also our outreach narrative to bring awareness of the community of our valuable services. For example, we just shared, for patients who are underinsured, who don't have income or fall below the 200% poverty level, they can receive services as low as $5, including generic prescriptions, a part of that. And so being able to share that story is a very powerful tool to really build our platform in our communities that we are so that we can thrive. But the work isn't done. I think this was the first phase of us trying to build our capacity. But as the downwinds and upstream winds come, we will have to continue to do other efforts to pull in more awareness of our services. And again, I think with the adding the third site, it creates a larger footprint within Wayne County to be able to address the healthcare concerns across the community. And so that's really, our focus of how do we analyze the county as a whole, utilizing the efforts from the HHBS department, understanding gaps, as far as access to care, collaboration, with community partners, and really trying to drive home the narrative that we are your local healthcare provider. But again, I think that there's still more work to be done there.
Very good. Thank you.
I'll move for approval, Madam Chair.
Okay.
Let's get this grant.
All right. It's been moved by Commissioner Colleen, supported by Commissioner Marecki. And I vote yes.
Yeah, we'll see.
Motion carries. Next item, please.
Moving back to the agenda, F, such other matters as may be properly submitted before the committee.
I don't know of any. Next item.
G, public comments.
Is there anyone online at this time?
There is no one on Zoom
Okay.
indicating that they would like to speak.
Thank you. Is there anyone in the audience wishing to make a statement? Anyone in the audience? Anyone in the audience? Since there isn't. Next item.
Adjournment.